Hello, dear fellas. It's another day, and today I want to talk to you about Placenta Praevia. Okay, so what is Placenta Praevia? Placenta Praevia is a pregnancy complication whereby the placenta is embedded at the lower segment of the uterus. The diagnostic criteria of Placenta Praevia is breeding of a brightly colored blood, which is fresh and painless. Okay, so the pregnant woman usually presents with breeding of a bright, fresh and painless blood. Okay, uh, so this placenta previa usually manifests after 28 weeks of gestation age in most of pregnant women. All right. So for a woman who presents with placenta previa, the investigations to be that needs to be done include full blood count and blood grouping and cross matching. Okay. Also, you need to check the coagulation profile. Okay, and also CT scan examination can be performed in order to assess for the state of the fetus. Okay, to assess the state of fetal well-being as well as um, the localization of the placenta in the uterus. So also CT scan is important. Um, so what is the management of a woman with placenta previa? Uh, for those women who are asymptomatic, the management is they need to be counseled to have enough bed rest, okay, to rest. But for women with, for instance, this placenta previa, it can be partial or complete. For instance, for women with complete placenta previa, for women with complete placenta previa, uh, the the management that needs to be done is cesarean section delivery. Now it depends on the gestation age. If the gestation age of the woman is less than 34 weeks, then uh, the woman should not be delivered first. The woman should be admitted to the hospital and uh, should be lung maturity of the fetus should be facilitated by giving the woman um, uh, the drugs that facilitate lung maturity, um, for example dexamethasone. Okay, but if the woman has uterine contraction, tocolytics also should be provided. This short-acting nifedipine 20 milligram starts, okay, and then followed by long-acting nifedipine 20 milligram, 8 hourly for 5 to 7 days. Okay, so this is important in order to control fetal uterine contractions, and to provide loom and enough time for the enhancement of lung maturity of the fetus. But if the pregnant woman presents with placenta previa, um, is 34 weeks and above, then and also there is minimal bleeding and no uterine contraction, uh, uh, and also the head is engaged, then the 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 preferred mode of delivery is delivery by spontaneous vaginal delivery, and so for that reason, um, artificial rupture of membrane should be performed, and so as to enhance spontaneous vaginal delivery. For women with placenta previa and they have premature rupture of membrane, um, antibiotics such as ampicillin 2 grams start followed by amoxicillin 500 milligram, um, they should be given. Okay, amoxicillin is given 500 milligram 80 hourly for about 5 to 7 days. These are given as prophylaxis in order to prevent infection, and also the woman should be monitored for signs and symptoms of for the signs of bleeding. Okay, the pregnant woman should be monitored for bleeding if uh, he or she presents with premature rupture of membrane. Also, if the woman presents with the risk of premature delivery, um, the woman should be referred to a health facility which has which offers the neonatal care services. Okay, fella, that's all for today. Until next time, thank you for listening. Bye.